Well, good morning, everybody. I just received a detailed briefing on our state's emergency plan for Ebola with our state's epidemiologists, Dr. Joe McLaughlin and Dr. Michael Cooper. I'm also joined today by Commissioner Bill Struer of Health and Social Services and Melinda Freeman, who is the director of the municipality's Department of Health and Human Services. Every indication is that Alaska remains at low risk for Ebola, but it is a real concern. And I have set a high bar for preparedness in the state across a whole range of needs, and Ebola is certainly one of those areas where we want to raise the bar on our preparedness. We live in an interconnected world with the ease of global travel, and certainly we are an international crossroads, so we want to be conscious of that. And we are preparing for the worst case scenario, even though we are at low risk, so that we can be prepared for any event there. As such, I have directed the Department of Health and Social Services to take some actions. I've directed the commissioner to create a multi-agency Ebola task force to coordinate planning and preparedness efforts among multiple agencies. They've already met a few times, and I've asked for weekly briefings for the length of this potential public health concern. We'll ensure that Alaska state hospitals and nursing homes are represented in the task force as well. I'm also directing Department of Health and Social Services to continue their efforts in what's called all hazards planning. It's an effort that's been going on for many years now to be prepared for all hazards, including infectious diseases of all kinds. But I'm directing them to continue their efforts there in planning, equipping, training, and exercising with providers and facilities. I've directed DHSS to conduct additional walkthroughs with healthcare facilities to assure they and we are ready for suspected cases. DHSS will immediately institute weekly open forum teleconferences for healthcare providers and communities statewide, and there is actually one today with healthcare providers from around the state. I've also directed DHSS to create, for statewide dissemination, an emergency quarantine order template as soon as practical. And finally, I have directed Homeland Security and Emergency Services to review and update our division's response and readiness plans. Just to get a few key facts on the table before we get to your questions, the CDC has targeted 10 states to look for volunteer hospitals to participate in the Ebola medevac program. Alaska is not one of those 10 states. Early recognition is critical to controlling the spread of the Ebola virus, and all healthcare providers and facilities should be familiar with and implement screening for Ebola cases in their practice setting as appropriate. Our Division of Public Health section of Epidemiology has been working closely with its partners to make sure everyone is prepared, and this has included a multitude of activities. Some interagency teleconferences, multidisciplinary lectures to healthcare providers in different settings, public health alerts, multiple television and radio media interviews, frequent telephone and email consultations with stakeholders, and they've participated in regular teleconferences with the CDC and other states to ensure updated and accurate information. All of these activities help maximize the chance that any people in Alaska who are at risk for having Ebola disease will be handled appropriately, and any risk to fellow Alaskans will be minimized. If a suspected or confirmed case is identified in Alaska, Commissioner Struer and our state's chief epidemiologist, Dr. Cooper, standing here, can discuss what protocols and procedures will be immediately followed. I'll have him do that shortly. We know from the Alaska State Hospital and Nursing Home Association that many of the state's hospitals are actively preparing for the potential challenge of evaluating and treating Ebola-infected patients seeking care. And preparations include ensuring availability of that personal protective equipment, providing updated staff training on the proper way to put on and take off the equipment, updating policies and reviewing procedures for collecting, testing, and transporting specimens, and running drills to safely manage patients who exhibit Ebola-like symptoms. The Alaska State Hospital and Nursing Home Association is also actively working in partnership with the state's epidemiology section to ensure effective communication of current treatment and procedural guidelines. Finally, for Alaskans, this is cold and flu season. Be extra diligent with your personal hygiene and mindful of the need for heightened awareness when it comes to travel. Many Alaskans also now are taking advantage of yearly flu shots and would encourage Alaskans to do that in consultation with their healthcare provider. The Division of Public Health will continue to provide the most recent Ebola information on their website. That's www.epi.alaska.gov. So in summary, our state's experts believe that Alaska remains at very low risk for the Ebola outbreak, that it is a real risk, however, and we are not sounding the alarm, but we are being proactive in preparation. That is the name of the game. Be prepared. That said, we're preparing for the worst case scenario and will be closely monitoring developments to ensure that Alaskans are protected. That's our highest priority. So I'm going to ask Dr. Joe McLaughlin and Dr. Michael Cooper to answer your questions. Why don't you jump up to the microphone?
Thank you.
And if you could identify yourselves, please.
And title.
So, yes, I'm Dr. Joe McLaughlin. I'm the chief of the Alaska section of epidemiology and the state epidemiologist.
And I'm Dr. Michael Cooper with the Infectious Disease Program with the section of Epidemiology and the Deputy State Epidemiologist.
Well, doctors, just to follow up on what the governor just said, that we are at low risk at this point. What, I don't want to instill fear, but why do you believe that we are at low risk at this point?
Sure. So, looking at the number of people in Alaska that have family ties to the affected countries in West Africa, and then looking at the number of Alaskans who we can identify that are going over there to help that are then returning to Alaska, that number is low. The best that we can estimate it, the number is low. So just based on the sheer number of people that will be coming back to Alaska, the risk is low. However, it's real. And part of that has to do with Ebola and the 21-day incubation. So you can be exposed one day and not develop symptoms for up to 21 days, which gives a person a lot of time to travel pretty much anywhere in the world. So that's why we're saying the risk is real, and that's why we're taking preparation so seriously.
So I guess to let people know more, what are some of the symptoms? I know that we've heard of fever, and that was the case with the second nurse that she was allowed to go, but what are some of the other symptoms that we would see over those 21 days?
Unfortunately, the symptoms of Ebola are pretty non-specific, which means you can get a fever, and many do, but you can also get muscle aches, you can get upset stomach, diarrhea early on, a sore throat, a bad headache are pretty common in these patients. But unfortunately, there's not one symptom or a number of symptoms that point you to think about Ebola initially. So the importance of asking a travel history early on with anybody with any of these symptoms is critical. So if you come in without a fever, but you've got a severe headache and an upset stomach, you ask, have you been in West Africa in these 3 countries in the last 21 days? And if the answer is yes, you go to the next part of that algorithm, which hopefully leads to calling us at the section of Epi to give us a heads up so we can help guide you through the process. So.
The governor acknowledged that early recognition is really key to preventing the spread. When I recently spoke to DHSS, I was told that Alaska doesn't have the testing equipment for rapid testing of the Ebola virus. Is that at all concerning?
Thank you for that question. So the Alaska State Public Health Laboratory has volunteered to be an Ebola testing laboratory. And so our laboratory capacity for testing will be up and running hopefully by the end of next week. And so CDC is sending us the necessary chemical reagents that we need, and then we have to undergo some internal testing. Once that's done, we'll be ready. Until that time, if there were to be a suspect case of Ebola that a healthcare provider was seeing, what we would do is facilitate specimen collection and transport to the State Public Health Laboratory, and then those specimens would be transferred down to CDC for rapid testing.
And so how long, once we get this new testing material, how long would it take to confirm that someone does or does not have?
So until that time, the turnaround is rapid, and we use this process, for other diseases quite frequently. So it's within 2 days we'll know. But the important thing there is that that's not going to affect anything. Once you're thinking Ebola, once you've called us, that patient is isolated. We've started the contact investigation. Whether, until that test comes back, we have isolated them. The risk has been reduced. So then we wait for up to 2 days. Once we have that test in-house, the turnaround is quicker. I don't know the exact time frame on it. But again, the important message is that as soon as that person hits that, yes, I've traveled to this country, yes, I have symptoms, isolation has happened, contact investigation is starting, and we're in the loop, offering further guidance and support. So.
And what's, just to follow up on that with what's going on because of what happened with that flight, that Frontier flight from Cleveland to Dallas, now you've got, so much concern just spreading out there. I guess because of all the way that it now all of a sudden it just seems like everything's spreading out there, what is it that you want people to know in terms about Ebola that you don't have it? Or is there anything you can say to assure them that they don't, or make them feel more comfortable?
Right. So the big issue, and this is something that Dr. Cooper already underscored, is exposure. Recent exposure, anybody who has traveled to West Africa, in particular the 3 affected countries, if they develop any signs or symptoms, and Dr. Cooper went through all the signs and symptoms that people initially present with, that means go in and seek health care immediately. So we're really encouraging people, not to travel to those 3 countries. CDC has already been very clear about this. All unnecessary travel to these 3 countries should be avoided. However, if you're doing missionary work or some sort of volunteer work where you're going and assisting with the situation, it's self-monitoring. When you come back, you should self-monitor for those symptoms, and if any of those symptoms develop, immediately go in and seek care.
Well, as what happened down in the lower 48, all of a sudden you got somebody that was on that plane, and even though they weren't over there, they may have come in contact with someone. It's like that old commercial, told 2 friends, they told 2 friends, and it's just being passed along. Is there anything, I guess, you can say, even if you didn't travel, that you're out there, but there are precautions you can take?
Well, fortunately, what we have in the United States is very different than the infrastructure that we have in West Africa in terms of our disease detective, the disease detectives that we have at state health departments, local health departments, and at the federal level. They're very skilled at contacting anybody who's been in close contact to a suspected or confirmed Ebola case and making sure that those folks are notified and can monitor for symptoms. So, for example, with respect to the recent case, the patient who traveled on board the airplane, all of the people who were surrounding that person in the airplane have been contacted and informed to monitor themselves for signs and symptoms.
Do we have anybody online, Sharon?
Operator, could you take us off lecture mode, please?
Certainly.
If there are any reporters with questions, we're ready for that.
Hello, this is Becky Bohr with the Associated Press. If somebody there could talk about if somebody is confirmed, what procedures are in place, including response from hospitals, what would happen at airports once there is a confirmed case. Could you go through those steps?
Do you want to start, and then we can work together on this?
Sure. Okay. Sure. So, I think a good thing to start with is that as soon as we get a high-risk suspect or certainly a confirmed case, that immediately we're notified, but then we are on the phone with the 24/7 CDC Emergency Operations Center. So we're getting guidance from the world's experts, essentially, the people that are involved with the West Africa response. So we're getting, the latest, the most updated information on handling those patients. I think another part to emphasize is that with our outreach, with our collaboration with all partners, infection preventionists, hospitals, clinics throughout the state, we are aware and we've been involved with some of the preparation within the hospitals. So hospitals are at different levels of preparation. All of them are thinking this. Some of them have gone as far as doing walkthroughs, meetings, developing, in the process of developing policies and protocols for that. So, we've got the basics in terms of algorithms you can find on our website. We've got our collaboration networks, our cooperation and our communication set up to make sure that we're getting the latest guidance as we need, and we're passing that out to our partners as well. So,
yeah,
I don't know if you want to.
Sure, I can add to that. One of the questions that's come up with some frequency is, what if in the hypothetical situation where a patient were suspected to have Ebola en route on board an aircraft that's inbound for Alaska, and this is something that's come up a lot. So. With some frequency is, what if I think we're getting feedback.
Hypothetical
situation where a patient were expected to have Ebola en route on board an aircraft that's inbound for Alaska, and this is something that's come up a lot. Okay, can you hear me okay? So, federal. Yes, someone's inbound. So there's a federal law that requires the pilot to report that they have a suspected patient on board the aircraft and the aircraft is inbound into the state. Alaska is very fortunate to have a CDC quarantine station stationed at our airport. And those those persons who work at the quarantine station are very skilled at rapidly identifying patients. We have an isolation room in the airport that we can bring a patient to. And then we have our Anchorage Fire Department and other groups that are willing to go ahead and transport a suspected patient from the airport to a hospital. We've already heard from several of our major hospitals in state that they are ready and willing to care for a suspected Ebola patient. So a patient would be transported to a hospital and then cared for there. As Dr. Cooper mentioned, there is a state mandate, a state law and regulation that requires immediate notification of public health officials if there were a suspected case of any hemorrhagic fever virus, and Ebola is one of those viruses. So we would get an immediate notification from the quarantine station. That would prompt us then to start connecting with our contacts here in Alaska as well as at the federal side. CDC has already stated that they have a rapid response team that's ready to go day of a report. So CDC would send a response team up to assist us with any contact investigative work that we need to do and other public health interventions.
What about in rural areas of the state, especially now crab season is starting, you have people traveling from around the world to work with processing plants, say in Alaska?
You want to start with me? Sure. Yeah. So we've reached out to places where we think there's a higher likelihood of somebody coming to Alaska from one of these affected countries. And again, to emphasize, we're low risk. We get a small number of people from these affected countries. But the places we've identified where large numbers of people might be going, like on Alaska, like to some of the canneries, we have reached out to. So as recently as yesterday, we had a teleconference with leadership in Unalaska and talked to our federal quarantine station about outreach they've done to the canneries. And so we know exactly what their processes are, their procedures are, and we've given them, again, the updated, most recent information. We have those lines of communication open. So, but then you think about, what about anyone and everyone else that has a concern that someone might come and work for them or visit to their establishment or locale? That's what we're using media for. That's what we're using our health alert networks, our media, radio, television, to get the message out about, here's the updated information. If we were not able to contact you and outreach to you directly, please contact us if you have questions about anything, about recommendations, and we'll get you that information.
So do rural areas have the ability to quarantine people?
Oh, absolutely. They have, any local clinic, any local hospital has the ability to safely isolate a patient. And they do this all the time for tuberculosis, for measles, for other infectious diseases. So the basics are in place. Now, what we're doing through our education and outreach is ensuring that they're practicing these things, that they're up to speed, that if there's any new guidance, that they're getting it quickly.
And do they need any special gear? Or?
Absolutely not. But I think what they need is practice and making sure that they're using these sort of tried and true infection control measures. They're practicing them. They're ensuring that they're following them strictly. Thanks.
Just to follow up on something that you said, and Governor as well. You said that hospitals around the state are ready to step up and take care of Ebola patients. Governor, you said something just a moment ago that Alaska is not one of the 10 states with the CDC.
Yeah, I'll let the doctor address
Sure.
that.
Yeah. So CDC has already designated several hospitals as Ebola care hospitals. So if somebody is coming en route from West Africa, via Europe, and it is either known to be a suspect case, or we identify rapidly once they land on the ground that they're a suspect case, then CDC will facilitate transport of those patients to one of the designated hospitals. Now, what happens when somebody is already in a state? Every state in the nation has already identified hospitals that said, yes, we are willing to and ready to care for a patient should a suspect patient be identified in our state. And that's true in Alaska as well. We've heard from several of our large hospitals that, yes, we are willing to go ahead and care for a suspect Ebola patient.
Since healthcare workers have been the two most recent people that have contracted the disease, what assurance do we have that that wouldn't happen here? Obviously, they were taking lots of precautions. What assurance does Alaska have that our system is going to be better in place than theirs was?
So yeah, so this is what we've seen in West Africa also. The people that are getting infected are the close family members, the people that are, living in the same household or caring for a deceased person's body, or the healthcare workers. So what happened in Dallas was that the 2 people identified at this time with Ebola have been the healthcare workers associated. And what we've seen, and this is, this goes back to what was mentioned before about sort of the changing nature of the Ebola response and how we're doing our best by, daily or weekly phone calls with CDC and other states for updated guidance. There's been a renewed focus and emphasis on infection control and getting appropriate training messages out to states, to local jurisdictions, and then to the hospitals. So there have been beefed up efforts on the part of CDC and others to put out clear, updated, and better guidance to hospitals, to nurses and infection control preventionists about how to put on, how to take off equipment, what other things are recommended, making sure, again, everyone's on the same page with the latest information, but then offering more training. So more trainings, video trainings, online trainings are coming from the federal level to us. We're ramping up efforts to get these messages out to hospitals, to clinics, to infection preventionists, to make sure that they are not only getting this, but that they're implementing them. They're sitting in their hospitals with their staff and they're saying, let's run through some drills. So we've been involved both in the hospitals with them assisting and also just on teleconferences, making sure that they have this information and that if they have any questions or seek more assistance from us, that we're there to assist them with that. So.
Yeah, maybe I can add to that. As Dr. Cooper alluded to, this is a rapidly evolving situation, and we are much better prepared today as a nation than we were prepared last week because we're learning. We're learning from the mistakes, and these are it's nobody's fault per se. I mean, this is certainly everybody at the hospital that in Texas that had cared for the patient wanted to make sure that every healthcare provider was protected to the highest level of their ability, but there were some breakthroughs in the personal protective equipment and infection control procedures, and we're learning from that.
Would you also just let the reporters know who they should contact for follow-up and additional questions?
Sure. Anybody who has additional questions, you're welcome to call the Alaska section of Epidemiology. Our phone number is area code 907-269-8000. Dr. Cooper is the manager of our infectious disease program, and we have a team of epidemiologists in that program that are specifically poised to respond to any questions that folks may have. We also, as the governor alluded to, have a fairly robust Ebola webpage that's available on the section of Epidemiology's homepage, which is www.epi.alaska.gov.
Thank you.
Will there be screening at the airport?
Last question. Go ahead.
Well, first of all, I think I would emphasize that we have this quarantine station in Anchorage, a federal quarantine station. So there is screening that goes on and has gone on for many years for any quarantinable disease to make sure that anybody presenting at the airport in Alaska with concerning symptoms may not be allowed entry due to those symptoms or needs to be evaluated. So in terms of enhanced screening, as you know, that was implemented at a few airports in the United States. The efficacy of that is questionable. Like how much are you going to pick up by doing this additional enhanced screening? As mentioned before, a person can develop symptoms up to 21 days after being exposed. So, it's good that they're doing it. I'm not sure of the efficacy. So if it were to come to Anchorage, which I'm not aware of any enhanced screening coming to Anchorage, I'm not sure how much it would help, how beneficial it would be. There's already a robust preparedness framework in place that I think is good. So,
Dr. Cooper, just to follow up on that, to the best of your knowledge, has anyone ever been quarantined out at Ted Stevens?
Oh yeah, obviously not for Ebola, but for tuberculosis, measles, anything. We frequently get calls about patients on airplanes that have concerning symptoms that we get involved with, that we help sort of tease out, what's going on. Does that person need immediate evaluation? So, in my time with the section, we've had patients that have arrived that have had to be transported over directly to the emergency room, and then we're involved early on in determining the infectious potential contact investigations that ensue. And this has been for various diseases, oftentimes tuberculosis, measles related, things like that. So, yeah.
If I could just follow up on your question really quickly. So what we're hearing from CDC is that about 150 patients, or 150 persons from the 3 affected West African countries arrive in the United States every day, and 95% of those people go through the 5 airports that have already been selected to do the screening. So,
And the efficacy is low, I'm assuming, because the fever isn't the only symptom. So even if you have a they're just checking temperature, right?
Or delayed onset of symptoms up to 21 days later, and the exit screening that's going on in these countries. So these 3 affected countries have intact exit screening that's going on that both looks for symptoms and then also has an extensive questionnaire asking about risk factors for Ebola exposure. So, yeah.
So we're going to wrap up, and I just want to say thank you. A couple top-line communications we wanted to make sure that were conveyed. One, that Alaska remains at low risk for an Ebola case and outbreak, but it is a real risk. Number 2, we're being proactive about preparedness. And number 3, we have a long history of preparing for all hazards, and we have a good foundation in place. But number 4, we appreciate the partners that are working together. So for instance, not just the State Department of Health and Social Services, but the municipality of Anchorage, the hospitals, the healthcare provider associations. We are all in this together working on preparedness. So thank you for being here. Thanks for your questions.
Governor, just to follow up on one thing, on a different subject, on the comment that you made yesterday. You had mentioned regarding the National Guard that you, within 24 hours, made some inquiries and realized that you could not trust the head of the National Guard to tell me the facts. Would you elaborate at this point what those concerns were at the time?
What I will say is I had conflicting information, and that was the point when I brought in the National Guard Bureau to do their investigation. Thank you all. Thanks.